Thank you, Chris. The U.S. may finally be getting the upper hand on the opioid epidemic. The CDC says predicted drug overdose deaths nationwide were down 27% last year compared to 2023.
TV5's James Felton has the reaction from a local addiction treatment center and what's fueling this positive trend. James?
The CDC tells us since late 2023, overdose deaths have steadily declined each month. The agency says it's a strong sign that public health interventions are making a difference and having a meaningful impact.
I think it is the end result of multiple things all happening and unpacking at the same time.
Dr. William Maroney talking about a nationwide drop in drug overdose deaths. According to the Centers for Disease Control, there has been a 27% decrease in predicted drug overdose deaths in 2024 compared to 2023. On average, this decline suggests more than 81 lives saved every day. Here in Michigan, the decrease is almost 36%. Maroney, who is the medical director of Recovery Pathways, believes there are 5 reasons for the drop in drug overdoses. The end of COVID restrictions that resulted in isolation. Increased access to buprenorphine, a drug used to treat opioid addiction. Greater general acceptance for mental health and substance abuse treatment. People at highest risk for overdose are getting help. And legislators that control funding see the outcomes of treatment. Maroney tells us Genesee and Saginaw counties are 2 places that are getting the job done when it comes to tackling addiction.
Counties that did really well and reduced overdose deaths had high levels of buprenorphine per milligram prescriptions. That predicted what the nation would get. The nation just caught up to the isolated pockets of success. Now it's all happening, and it's all happening at the same time.
And Maroney expects this momentum to continue. He thinks the U.S. Health and Human Services Secretary Robert F. Kennedy Jr. will be an advocate of funding treatment for addiction. Maroney would be surprised if the federal government cuts funding in this area.
People in recovery pay taxes, stay out of jail, have jobs, and are productive. And I think RFK Jr. will take that message because, you know, he may be in the Trump administration, but he's a lifelong Democrat and he's libertarian and he's been in recovery. We've had people who are sympathetic to recovery, but he's a heroin user in long-term recovery. He will never let that happen.
The CDC says that despite these overall improvements, overdose remains the leading cause of death for Americans age 18 to 44, underscoring the need for ongoing efforts to maintain this progress. Back to you.
Thank you, James. Only 2 states saw an increase in predicted drug overdose deaths, South Dakota at 2% and Nevada at 3%.